How are you feeling?
I feel fine. Um, honestly, I would not have even gotten a COVID test, except for the fact that one of my security detail tested positive, who was a close contact. So, we just try to follow the same rules everyone else follows, which is if you are a close contact of a positive individual, you get tested right away and you isolate for 14 days. So I would have isolated anyway once one of my security guards tested positive. But, if he had just, been kind of under the weather and not gotten a test, we would have never known. So in this case, the system worked the way it's supposed to. He went and got a test. He's positive. I immediately got a test. The moment I was positive, I'm in home isolation.
Yeah, and ever since you came out with this yesterday, first of all, a lot of outpouring of support, thoughts with you, because you have been really the face of the fight against COVID, and for you to get it, I mean, I guess some people would say, with all the work that you do in the community, it really was to be expected. Do you agree with that?
I do. To tell you the truth, Jamie and I always expected that I would test positive for COVID eventually. This was my fifth, maybe sixth test. And I've been getting tested because I wanted to make sure at intervals that I didn't expose anyone. Because a lot of times this is one of the things we always are preaching, which is you could be an asymptomatic carrier. And I do have some moments, not a lot, but some where I'm with people close up. Like yesterday, I was with some really nice people at the radio station. Oops, I'm sorry. I was with some nice people at the radio station, and they, we were together, and they wanted me in the studio. So, some part of it we weren't wearing masks because we were doing broadcast. So, I always wanted to know whether I'm positive. And then an hour later, I found out that my close contact, one of my staff, was positive. So we called them, and they're all going to get tested. They'll be fine. But this is the way it goes. So if I may, a teachable moment, it's why I've been fighting for contact tracing and testing constantly, right? If we didn't have adequate testing, we would have never known that my staff member was positive, his wife was positive, that we were close contacts. If we had known sooner, then he would have taken the weekend off, and I likely wouldn't have contracted COVID. But that's, it's no one's fault. It's just if we achieve our goals, which is having 400 or 500 contact tracers and over 10,000 tests, then it's never a question. I'll tell you a little bit more to the story. I think you might be interested. So my team member, who's just great, he's doing real well. That's what matters most. So his spouse felt sick and went over to a hospital, and they got treated, but they didn't run a test. They didn't think it was bad enough or worrisome enough to run a COVID test. That was about August 31st or September 1st. And so she, was kind of sick for a week and not getting a lot better. He was feeling fine, right? But he was with her, living with her. If they had tested then they would have self-quarantined together, and he would have taken some time off, and none of the spread would have been stopped right there. It's okay. They didn't do the test then. He came and took me to work, and we did our job together for the weekend. He started feeling sick on Tuesday, and by then we had spent time together, and obviously it seems like we spread it between one another, and I caught it. They then got tested and found out they were positive. And so since then, other people got exposed, my family, for instance, right? So the more testing and tracing we do, this is a perfect illustration of this, the fewer cases we'll see spread. And the fewer cases we see spread, the faster we will open up to our lives again, to tourism or education. So it used to be abstract for me when I yelled about having 500 contact tracers and 10,000 tests. But now you can see what I mean. If we do that, don't worry about me, but people out there who are kupuna and whatnot, they will be less likely to catch the virus. Other people will be less likely to be potentially, forgive me. Oh, sorry. They will be less likely to potentially. Yeah, a lot. So people are so nice. By the way, thank you, everybody. I've had thousands of incredible, sweet comments. So thank you for that. I'm fine, everybody. But that's the message here, and you can catch it. I mean, we were in a car together essentially for an hour driving up the coast and an hour driving back, and we were wearing masks except we take sips from our coffee. And being in a car together, I guess, was enough for that to be the likely way that I caught COVID. No big deal. It's just it's just human nature to be with one another. But if we can socially distance the best we can, we won't spread it. And if we have our masks on and we catch the virus sooner, we won't spread much.
Yeah, you really underscore that importance of, you know, the loss of a day or 2 days, just it exponentially grows and the spread just gets more and more out of control and the tracing becomes more important. You know, I don't know if you feel comfortable talking about which hospital that was where they were really restrictive on making that call of the test.
In this case, because I, I, I won't personally mention it because even though I'm bummed out that they didn't do the test that day, and one of my colleagues was really upset with them because he loves me so much and wished they had gotten that test done. I understand how many people are coming for tests right now. You get thousands and thousands of people getting tests, and the person wasn't too sick; they just happened to have COVID, which is
Does she have
that.
the
But
symptoms?
uh, I think she just had some basic upper respiratory symptoms, so you could have justified a test. She also does have a history of a weakened immune system, so she should have gotten tested. There's no question. She got put on some antibiotics, which won't treat a virus. But look, I've been there myself. I've made a judgment call and have to stand by it. I will say that I am very, very permissive about ordering tests, and I always have been from the beginning because I figure burning one extra test, if you can save. Look, if she had been tested positive, we would have isolated and cared for her. Her husband would have stayed home, but then I would have never needed a test. My whole staff would have never needed a test. The Kumu folks over at the radio station would never need a test, and my children and wife would not have needed tests. I will suspect that probably none of them, or maybe hopefully none of them, test positive, maybe one or two, but we're pretty careful, except my wife. I'm guessing Jamie's going to test positive, and I'm gonna be sad. She'll be fine. She's younger than me. She's super healthy. She's fantastic. But that it's always some risk. It's some concern. I'm gonna be careful what I say because my children will watch our interview. But we share fears like anybody, and so that's the benefit. It could have been any case across Hawaii. If you get that test at the right time, you might stop the need for 20 other tests and 5 other cases, right? So everyone, I hope they'll listen when they see me promoting 500 contact tracers and 10,000 tests. It's for a reason, for a short time, so that this doesn't happen, and that we open the economy and open schools. I guess I had to get COVID to make my point, so it's okay, but it is happening everywhere across the state, and every time we miss one, we set off this chain of events.
You're so diplomatic, Lieutenant Governor. I would say it's not okay, you know, that this really could have been prevented. And unfortunately, you, as you said, have become part of the numbers, more than 10,000 that we've seen because of this type of restrictive, kind of approaches. And is there any way we can change this at this point? I mean, we are really at a crisis.
There is a way, and it's happening. One of the things I'm working on the rest of today and yesterday and so on with Fort Fujigami is we put out the request for proposal to now take ourselves up to about 13,000 tests a day statewide, which is, we're going to spend some of that CARES money, which we should, and it's money well spent because you spent to prevent the spread of this stuff. Then you don't lose out on having our businesses closed. I mean, you don't have to have them closed. You don't have people away from work. You don't have, people can end up in the hospital with extreme illness or consequences or cost, all those things. So yeah, so we'll go up to 13,000 tests in the pretty near future. I believe they're going to award that bid soon, and I am very pleased about that. I'm already readying a proposal to have, after the surge testing is done, 6 to 8 drop-in spots where people can go get tests quickly without a doctor's order will be my recommendation, because once again, look, spend a small amount of money to reassure people and to guarantee that they're not positive in exchange for the benefit that none of this spread occurs. So let's do that. That's what they did in New York State, and that's how they got their percent positivity rate way down. We're starting to turn the corner. Our positivity rate today was 2.44%. We have 131 positives out of 5,360 tests. I have a new board. I'll show you.
Oh, okay. So we're getting a preview of your daily whiteboard
Yes,
session. Okay, great.
exactly. They've given me a portable whiteboard now, so for my children's room. But yeah, so we're going to have the extra tests, so up to 13,000 tests. You see that the contact tracing project is finally getting up and working. There are over 200 people, and they're going to add another 100 some soon. It's ironic. I was going to be with them yesterday to deliver pizza just to thank them, and then this all happened. So we just, we had the delivery guy deliver pizza. But the point is, there are a lot of them there now, and it's going to be great. So we do the tracing, we do the testing, we won't have people getting sick and go to the hospital. And then finally, we can get open. I'm advocating directly to the governor to open, and he has to make the decision October 1st. And if not October 1st, maybe 2 weeks thereafter. Gov has to make that decision. I respect that. But this is a cautionary tale, right? If we do the right stuff on the public health side, we can open. If we do the right stuff on the public health side, we can have schools go. If we have the right stuff going on the healthcare prevention side, we won't fill up our hospital beds. If we do the wrong thing, welcome to my world. So, I just want people to know that it's real. And the most important thing is to prevent it spread so kupuna don't get sick. I mean, that's really what it boils down to.
Yeah, you make a good point though, but I do have to ask this because we've gotten feedback that says you of all people, the most careful, the
Yeah.
most, the one knowledgeable about all of this ended up getting it. How do all of these precautions really help then if you still got it?
Well, it's a little difficult question. It's a very good one. The reason is I have a lot of contact as I think we can say I'm kind of an outgoing, active lieutenant governor. And so I do a lot, and I'm with a lot of people. Even though we mask, even though we protect, it can't be perfect. And one thing everyone should remember is that 20% of all cases globally of COVID are among healthcare providers. That happens to be my other life, right? So I'm in touch with people, even when I'm walking out, exercising by myself, in spite of the fact that I think we should be able to walk with our loved ones, but I'm out there by myself and people want to stop and fist bump me and ask me about hydroxychloroquine or remdesivir, or how long their auntie should be in quarantine. So, or if I go to the grocery store, people are really sweet, but they definitely want to chat, and I love that. So I'm pretty likely one of the people that has the most encounters in the world with other human beings. So that Jamie and I always knew that I was likely to test positive at some point, which is why I've been getting these tests. Like I mentioned, I get tests somewhat frequently, because it's hard to imagine an emergency room doctor who also tries to be a public servant and see a lot of people, even socially distanced, isn't going to catch it. This virus is super infectious. But the good news is we know that the infectivity rate is way lower if we socially distance and wear masks. And we also have learned it's way higher if you blow it and you just open up your society and you're not careful. So it's really not at all about one person. It's about the trends and the population health, not just the health of one. It's about the health of many. And that's what I worry about. I'm much more worried about what's going on at the veterans home in Hilo than I am what's going on here at my apartment, except that I'm worried about my kids and wife. But don't worry about me. Worry about elderly people in a nursing home where there's spread. So by decreasing the probability of spread, we make it less likely that will happen. And then we just do our best.
Well, there has been concern. Obviously, all your work also involves Governor David Ige. And are you concerned that maybe he could have been affected by this? because of all
No,
those and the work that you've been doing?
I'm almost certain he couldn't be because we do all of our meetings through Zoom or Microsoft Teams or whatever. So for the purposes of continuity of government, we've intentionally not been together in meetings. Dating back to press conferences, we've actually started. Well, you could see that we separate in press conferences, and I'd end up doing a lot of individual interviews on like more technical pieces of the response. So that's been somewhat intentional. I know a lot of people think must be the Gov is pissed at Green again, but it's really, it's important that we have two people, each of whom can be healthy enough, and I should be healthy enough to keep doing my job. I hope and expect to. I'm gonna do it all day today, but you want both individuals to be healthy just in case, right? And then we've got great support from General Hara and the Attorney General, and the new Director of Health is just terrific, Libby Char, Dr. Char. So there's so many good people. The people that are running the tracing center, you know, they're great. So I've got to say that there's a lot of people working on this, all the military folks, all of the volunteers. It's amazing. But for me and Gov, we just don't spend any time in the same room. And, you know, I'm hard to deal with anyway. So it's fine.
Well, I'm glad you still have your sense of humor. Any final thoughts on, you know, as we watch you, I'm sure you'll be vlogging about this, sharing your experience. We'll follow along and hope and pray for you. So any final message there for our viewers?
Just final message is I'm totally fine. All I really care about is, please guys, be very safe so that this virus ends soon. The better we do these next 2 weeks on Oahu, but statewide, the fewer cases we'll have, the fewer people end up sick in the hospital, and we'll be out of this mess. So I just want you to do a great job wearing masks, socially distancing, and if you are like me and you catch COVID, stay at home in full isolation, away from people, and then it's going to be fine. Doctors will take care of us if we get sick, and we will look out for our loved ones, but don't make the mistake of letting your guard down ever, and we'll get through it together. We'll be totally fine.
All right. Well, Lieutenant Governor Green, always good to see you. I wish it was always a better circumstances than this, but like you said, a teachable moment. And so appreciate your positive attitude there.
You bet. Thank you. Thanks for sharing time with me.
Yeah. Take care there. We'll follow
You
your
bet.
story.
Okay. Sounds good. Take care.
Bye. Aloha.
Bye-bye. Aloha.